Hello everyone, today we're going to talk about hyperaldosteronism. There are several adrenal gland disorders, some of which are common and others of which are less common. The topic of today's talk is hyperaldosteronism, a condition in which the adrenal glands overproduce the hormone aldosterone. The cause of an increase in pressure is not always unknown, but there is occasional reasons. In the case of hyperaldosteronism, the cause is high blood pressure in addition to a reduction in potassium. After watching the video, you will know everything related to this defect, whether its causes, symptoms, and how to diagnose and treat it. Our role today is to answer most of your questions regarding hyperaldosteronism. Today we have Dr. Kim, who is a leading doctor at Seoul St. Hospital. He is going to discuss with us everything about hyperaldosteronism from an experienced medical point of view. Hi, I'm Umay. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Dr. Kim, so what is the hormone of aldosterone exactly?
Aldosterone is known as a hormone that releases potassium from the kidneys and reabsorbs sodium.
So what disease can occur with the lack or an excess of the hormone aldosterone?
Less aldosterone increases potassium in the blood and releases sodium, which reduces sodium levels. Conversely, when hormones are released a lot, the urine releases excess potassium and increases sodium reabsorption, resulting in hypokalemia and high blood pressure.
So what is hyperaldosteronism and what are the types of it?
The rapid production of aldosterone is called hyperaldosteronism. This is divided into primary or secondary causes. Primary hyperaldosteronism is the increased secretion of aldosterone in the adrenal gland itself. Secondary hepatopathy, on the other hand, means that the secretion of the renin increases, and eventually the aldosterone hormone increases. Hormone renin can be increased by blood vessels or medicinal substances.
The pathology for hyperaldosteronism, adrenal gland disease, hereditary fracture, what is it?
The common cause of primary is a tumor in the adrenal glands that produces aldosterone. Typically, familial hyperaldosteronism is a disease that occurs in heredity.
So what about the symptoms of this disease and how to distinguish this disease from hypertension?
A common symptom of hyperaldosteronism is high blood pressure. Among them, hypertension in the relaxation period is especially severe. The hormone aldosterone is a hormone that releases potassium, which is not common in patients with hypokalemia. About 30% of the patients are showing signs of hyperkalemia. Hyperaldosteronism is known to be the most common cause of secondary hypertension. Unlike other high blood pressure, it is a symptom that occurs in young patients. If you have symptoms such as high blood pressure, relaxation period, high blood pressure, etc., you should suspect hyperaldosteronism.
What are the methods for diagnosis of hyperaldosteronism?
Like Cushing's syndrome, hyperaldosteronism can be tested via screening and confirmation tests. Screening is a test that measures the concentration of aldosterone in the blood, the concentration of renin, and the level of potassium. Among them, the ratio of aldosterone and renin is measured, and if the rate increases by a certain percentage, it is suspected of hyperaldosteronism, and a confirmed diagnosis is carried out after that. Confirmation tests can be performed through tests using saline solution and sodium intake tests. When confirmed, CT tests are conducted to determine if it is only on the left side of the adrenal gland or on the right side. The adrenal glands that cause hyperaldosteronism are often very small and cannot be diagnosed by CT tests. So recently, we can conduct an optional adrenal vein blood collection test called AVS to check if the erythrosis is on the right or left side.
After diagnosis, what is the treatment?
Hyperaldosteronism can occur only on one side of the adrenal gland or on both sides. Hyperaldosteronism on both sides takes precedence in medication. So the internal medicine department treats first, and unilateral erythrosis, which occurs only on one side, is treated in surgery. As with other adrenal resection, it is recently performed with retroperitoneal laparoscopic surgery, and high blood pressure improves or fully recovers within about 6 months after surgery. Also, if the patient has low potassium symptoms, it can be treated within a month.
Final question. So hyperaldosteronism, what is the prognosis?
Bilateral hyperaldosteronism is treated with drugs, which makes it difficult to cure completely. Unilateral hyperaldosteronism appears to be completely cured or improved in about 30% to 60% of patients when operated to treat it with resection. The prognosis depends on the patient's high blood pressure period, the age of the patient, how much high blood pressure medication he or she took before surgery, how long it was taken, and whether he or she has heart disease. However, even if the patient's hypertension persists after surgery, blood pressure control becomes easier.
Thank you so much. That's it for today.
Thank you.
So today we learned many things about this disease, and the doctor explained in details everything related to this in treating disease. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.